Well, good morning. This is Dr. Mike, and I am here with Haley from Vibrant Integrative in Jeffersonville, Indiana. And I was talking to Haley about a client of mine, and I wanted to consult with Haley. So let me tell you a little bit about the client that I've got, and I want to see what your thoughts are on this, because this is something that I don't see all the time as a chiropractor. I don't see this all the time. So I had somebody come in to see me, and it's a 20-year-old guy, and he is going bald right here. He's losing his hair. Here around the edge, it's all fine. But up on the top, it's noticeably thinning, and he can see the trend that it's going. And so he started doing some of these creams like minoxidil and things, and it hasn't helped at all. It hasn't actually gotten worse, but it's not moving the needle any at all. And so he's progressively losing all this hair right here. And they reached out to me to see if there was anything I could do. And I have a little bit different way of thinking about things sometimes. And so we started doing a little bit of research. And I realized that there might be other things that are contributing to the hair loss up here on the top of his scalp. And so we started looking at the environment of the tissue, of what was actually going on at the scalp. We don't think that it's just always a genetic thing that just has to happen. And what we noticed is that when we're feeling around on his head, the top part of his head is very restricted and it doesn't move very well. And then when we get over into the area of the tissues where the hair is, it moves really easy. And so there's some research that suggests that mechanical stress and fibrosis, kind of scar tissue type stuff around the hair follicles may play a role in his alopecia. Now there's also a hormonal component to it as well for male pattern hair loss. But I've been working with the mechanical stuff and things that could also contribute to it. So let me tell you a little bit about what we've done, and then we'll talk about your thoughts on it and what you do and why I reached out to you to see if there was anything that could be done. So the 20-year-old's mother was worried about an autoimmune condition. And autoimmunity means that the body kind of attacks itself. Maybe the body is attacking the hair follicles. So autoimmune problems start in the gut. And so we started with a couple of things. One, we used bicarbonate baking soda to balance the pH of his body. Then we started using digestive enzymes to help digestive problems. Then we have him on some supplements, some powders to treat leaky gut syndrome. And we have some probiotics. And the combination of those things should calm down any digestive problems. It's more important for the body to digest the food than it is to heal this. And I know he wants to heal this, but we got to make sure that the digestion's doing better first. At least have our base covered. So we did that. And then that's when we started looking into the restrictions in the scalp. What we did then is we dry needled the scalp. We did it 3 times. There's some research that I found that says that there's a thing right here on the top of the head called a galena. And that means helmet in Latin, I think, or Roman or something like that. Latin, it means helmet. And that's where the guys have that male pattern baldness. And what that galena, it's a piece of tissue, and it actually gives place for like the muscles in your face to attach to, because they can't really attach to the scalp, so they've got this other thing up there. And my hypothesis is that that thing, that galena that sits right there, has become kind of fixated or stuck down to the scalp. So you got the skin and the galena and the scalp. And in this part down here are where the hair follicles are that make the hair. So if all of this is kind of stuck together and is compressing things, could that be keeping the hair follicles from getting their blood supply? And we need oxygen and blood supply to get into the tissues. also, we have been putting ozonated oil on his head to get oxygen in there. Plus, we have been using this cold laser helmet right here. And if I plug this in, you'll see that it lights up. And this is a cold laser. This is a red light treatment right here that he could put on the problem. And so if he puts this on there for 20 minutes a day, and we're getting oxygen into the tissues, and we're doing digestive repair, and there's one more thing that we're doing too. There's a hormonal component to it, possibly genetic, definitely a hormonal component to this alopecia. And one thing that it seems to get affected is testosterone gets converted to this stuff called DHT, I believe, dihydroxytestosterone or something like that. And that's what causes a lot of this male pattern baldness. So we found that rosemary oil might block that conversion. And so he's putting rosemary oil in jojoba, which I want to get your thoughts on jojoba, but rosemary oil in the jojoba and putting it on his hair to block that testosterone conversion. So we're treating it from a mechanical standpoint. We're treating it from a inflammatory component with the pH balancing and the gut repair. We're changing the metabolic environment around this hair follicle that's just kind of getting squeezed off. And so how do we actually measure these changes? Is there a safe way to explore this? I've never really heard of anybody doing this. And so that's where my brain went. We've been trying to improve the motility of the scalp, changing the environment, and you work with ozone.
I do.
And so I started wondering, what else could we do? What could we combine with what I'm doing mechanically with what you're doing biologically? And when I called you with this idea, what did you think?
I was very excited. With my history of working with ozone, I know of all the wonders that it can do. And when Dr. Mike first came to me, I said, let's try it. Let's do it.
So neither one of us is really claiming that we've discovered any kind of treatment for baldness. We're just taking a young dude that's got a problem, and we're looking at the physiologically from a couple different perspectives. And we're seeing, if we put these different perspectives together, is it something worth investigating? And so the real term for what's going on is called progressive follicular miniaturization, which means the hair follicles progressively miniaturize. And we think it's because they're not getting their blood supply and they're not getting the oxygen to it. And so, so it's not really, can we just increase blood flow? What we're really trying to do is change the mechanical, inflammatory, metabolic environment around this hair follicle that's getting restricted. And will it still be viable? If we can undo some of this stuff, will the hair follicle bounce back the way it's supposed to? And so, Haley, first, will you tell me who you are and what you do at Vibrant?
Sure. My name is Haley. I am a registered nurse in integrative medicine, and I'm in my nurse practitioner courses currently to be a provider under integrative medicine. At Vibrant, we do focus solely on IV therapies. We specialize in ozone therapy and do a lot of different integrative interventions for the community.
So what got you interested in this integrative medicine that you're talking about instead of just staying strictly with conventional nursing?
So I started after nursing school. I worked in the ICU. I did transplant and surgical ICU. Went to outpatient therapy and surgeries. And it just, there was more. I didn't know what else I wanted to do, but I knew I needed to do more. I didn't know what that meant at the time. So I actually started a master's program for nurse coaching through an integrative Pacific college in Chicago. And I realized that all the things that they were doing was actually like body healing. So from there I said, okay, no, we're gonna quit this and we're just gonna go on to nurse practitioner. So that's kind of where I'm at now. I found Vibrant Clinic walking to a farmer's market one day and just happened to pass a sign. So that's kind of how I got started there. It's a little Hallmark story, but yeah, and I'll never go back. Never go back.
Yeah.
It's incredible.
What changes that one little decision made? You never know, really. This is true for life. You never
Yes.
know what's going to happen. So in that clinic, what type of patients are you seeing there most often?
So we see a very widespread population. We see people who are coming for general health, just fatigue, tiredness. We see athletes who are recovering. We see patients with cancers, autoimmune, chronic pain, fibromyalgia, really across the board.
So if somebody has never heard of medical ozone before, how would you explain it?
So how I typically explain to my patients what ozone is I have them think of oxygen. So oxygen is O2, that's the molecule. Ozone is O3, so it is an activated oxygen molecule. What it does is it increases blood flow, increases circulation, but also is an inflammatory modulator, meaning that inflammation cannot survive in an oxygenated state. So that is super, super cool, thinking of the process that you came to me with. Thinking that if there is any inflammation with the hair follicles, that it will decrease that.
Can you think of any situation where you would say, no, ozone just isn't right for this person?
No,
No.
not a single one.
We run on oxygen.
Yes.
Our body knows what to do with it. So, I kind of know what you thought when I called you about this hair loss case. But have you ever considered, or do you know anyone who's ever used ozone for hair loss around the scalp or the hair follicles before I brought this up to you?
So the only time that we've really thought of it is with cupping. One of our clinics actually uses the cupping and hooks it to ozone to increase the blood flow, but also ozonate those, the pores and the follicles in the scalp. But injections, not really. But as I looked into it, there's a lot of science behind it.
It makes sense. If
Yes.
you get the oxygen and the red light and enzymes, it would be helpful too. But if you get that to the problem usually does go away. And so, we're using ozonated olive oil with him.
Okay.
And you take the ozone and you bubble it through olive oil and it absorbs the ozone into the olive oil. It becomes fully ozonated olive oil. It turns hard, it turns white instead of yellow. It's stable, you can put it in a jar, and we're using that on the hair. It's actually a peroxide. It's actually called ozonide at that point. But it's not as strong as ozone. But I think ozone gas, if we would be superior to the peroxide, the ozone oil. I think the gas would be superior, but it's just not that easy to continually do it on a regular basis.
Yeah.
And so we're using the peroxide oil, the ozonated olive oil for him. But there's another consideration that also, when we're injecting the ozone, we're actually physically putting a gas into a space where there's not a gas. And so putting that gas underneath the skin is going to just mechanically kind of lift the tissues up off of the follicle is what we're hoping for, and mechanically change that tissue's environment. It's independent of the work that the ozone can do with the oxygen, also mechanically lifting that galena possibly up off the scalp and giving the stuff some more room to breathe, essentially, is what I'm hoping for. Do you think that would be a reasonable option?
I do, specifically because if you're injecting that ozone gas, it's already going to circulate and decrease that inflammation around the hair follicles. But then also that mechanical factor of it, of lifting it up and creating that space for healing and for growth and regenerative measures, I think it's a great option.
So are there any other, we're using jojoba oil. I heard that jojoba oil is similar to the skin texture versus something like coconut oil or something. Are there any other oils? Because we're using it to mix the rosemary oil into. You don't really want to put rosemary essential oil straight on this. You want to mix it with something and dilute it a little bit. Are there any other oils that you can think of that would be suitable outside of the jojoba?
I think the jojoba oil is probably one of the best bets. I mean, that's in a lot of cosmetic products. It's in hair products, it's in skin products. It's just a very, very good carrier and very good for the skin. There is, if you wanted to do just kind of like a basic, there is glycerin. You could always just mix it with a glycerin. It might last a little bit longer in the glycerin. But other than that, I think the jojoba oil is probably one of the better options.
And so do you have any other, so he's also going to be, in addition to the red light, we're going to be working mechanically every day, grabbing the skin, moving it around, trying to free it up. We're using like silicone things, and we're using wooden scrubber things, and just the hair and the fingers, and spending some time every day massaging that. And then, but we're in uncharted territory here. We don't know what to expect.
Yeah.
And so a lot of people are hopeless anyway, so it can only go up.
Fair. That's very fair.
With your clinic in Texas, do you know, were they seeing results, and how long was it taking?
They were seeing results, but I'm not very sure on how long it was taking. I think it was very specific to that patient and maybe some other processes, kind of like we talked about with gut health and stuff that was going on. But I know they were having some success with it, just using those cuppings and increasing that blood circulation, also helping lift up like the fascia and things with that. And
So now that I'm thinking about this, so we got a thinning hair, and we're doing cupping on it. Does the hair get in the way of the cupping? I hate to say it, but
does it?
do you shave your head to do the cupping to get the hair grow back?
I wouldn't think so, but I understand where you're coming from. But I wouldn't think you would have to.
I wonder how much the hair would affect the suction. And actually, now that I'm thinking about it, if they're putting ozone into it, it's going to be air going in this way, which probably wouldn't make a suction. You would have to have air coming out to have a suck. I wonder if they would just kind of hold it on there and put it in different positions.
Yeah.
Yeah, because air going into something would want to push it out that way, kind of. I don't know.
Yeah. Because he does still have hair, right?
He does have hair.
Yeah.
He's got a bit of hair.
Okay.
But it's, you've seen women get that pattern baldness right there too. A lot of times that's a hormonal issue. And that's kind of what it looks like. There's hair there, and you can tell it's thin, but there's still hair there. It's just, he never said, I never saw hair on the pillow. It's not like patches just fell out. It just went bye-bye. And that makes sense if it's progressively getting smaller, that it would do that. It wouldn't fall out in clumps.
Right.
And now that I'm thinking about it too, there's actually two things that we've talked about changing. One is the tissue change, and the other one is the hair change. And so he'll know if it's growing back, but we actually like to have a little bit better way to measure it.
Right.
Like, I don't know how we would actually measure it, Would you look at like one specific area, and say if you start seeing little hairs start to come back in that area, we'll know that it's working.
Yeah.
I've heard at least 6 months. We've got to give it at least 6 months, because it's not like they're going to grow back in a big fat full hair shaft. They're going to grow back little bitty, and then they're going to get a little bigger and a little bigger, and it's going to start getting wider over time. Definitely within a year, I would say.
I would think so too.
For sure. Yeah, I think 6 months is a little ambitious, but maybe not.
I think it's reasonable.
We're doing so many different angles.
Yeah.
You know, we're attacking it from a digestive standpoint, from a mechanical standpoint, from a hormonal, from an inflammatory, you know, I think I said mechanical. That's at least 4 or 5 different ways that we're attacking this thing. And all of them have their own pros and, not cons, but I think all of them are contributing to it.
Yes. I think if you are somebody and you're just doing those like topical treatments without assessing the gut and fixing that nutrient deficiency that can potentially be there, or the digestive dysfunction that they're having, it would take a lot longer to see results.
Right, yeah, I think you're right. And then from your expertise, and I know the answer is I really don't know probably because we're in uncharted territory.
Yeah.
But there's 2 aspects of doing it. One is the ozone into the area, the oxygen to the tissue, and other is the physically, mechanically lifting that up. What would a treatment plan for you be like?
If I were seeing the patient, I would honestly probably do it weekly. I would do if we were doing the injections, I would probably do injections weekly. We measure ozone by gammas, so maybe starting with like a 10 to 15 gamma, just something really light, so that I know the scalp is pretty sensitive, so just making sure we're not gonna hurt them, like just cause them pain, really.
For sure.
And then it'll dissolve. I mean, ozone dissolves pretty quickly in the place that you put it, so over the next week or so, see how they do, and we could always increase the timing.
The body knows how to use oxygen for sure.
Yes.
I don't think it'll hurt anything.
No.
And so he doesn't know that we've been talking like this.
Okay.
I really just wanted to give kind of like a behind the scenes thing on stuff that actually does happen. I mean, you think that your doctors are talking like this, but they're not. They're not. No, they're not consulting, especially, you know, and they're not really looking outside the box for other solutions for things too. And that's what you get when you work with people like us and Vibrant Integrative over in Jeffersonville too. You know, we do talk and think outside the box because people are looking for answers, and the body knows how to heal itself. We just got to find the problem and start removing it and let the body flourish.
Yeah.
And so, so just kind of a loaded question, but what excites you about practitioners from like different disciplines like this working on the same difficult case instead of each of us just staying in our own little box?
I go to Dr. Mike for a lot of different questions. Everyone has a different story. Everyone comes from a different background, and everyone has a different perspective. So his perspective as a chiropractor is a lot different from my perspective, but they coincide greatly together. They're like bouncing off ideas. It is the perfect combination. So it's
it really
nice.
Makes it easier on us. Okay, it's all right to say I don't know the answer. You know.
Yeah.
And go find it.
Which happens.
Yeah, and go talk to people and find it. And you know, and so I do appreciate you being here, and I'm looking forward to seeing where this test case goes. I've got to get them over to you.
Yeah.
But you know, this is very important to this person. And I think it's a valid thing to do too.
I do too.
Yeah.
I do
so
too.
Thanks for sitting down with me and just talking this through, you know, together. And if you guys are looking for help, Haley, how do they get a hold of you?
Yeah. You can call us 812-725-0950.
And what's your address?
It is 300 Spring Street, Suite 3B in Jeffersonville, Indiana.
And are you guys going to be moving locations?
We are not. We are staying at the same location, but we will have Jeffersonville Integrative Clinic.
Gotcha.
Yep.
All right. Oh, Haley, thanks for your time and everything. And appreciate you being here.
For sure. Thank you.
You're welcome.